Hi, family. This thing is going to go over which PPE we should be wearing and when we should be wearing it. There still seems to be a little bit of confusion, and hopefully this will clear everything up. First, we'll just review the basics. We're all familiar with all of these things. The cloth mask, that's what we used to wear between March and September of last year. And it's also the mask that we're asking our residents to wear whenever they're in a common area. The surgical procedure masks are the ones that we wear when we're on shift and we don't have any isolation or quarantine residents that we're caring for at that particular time. Respirators refers to KN95s or N95s. KN95s really can't be fit tested. They do offer a higher level of protection than the surgical masks, but they're not quite as good as N95 masks. N95s you're familiar with. These are the ones that must be fit tested, and you have to be fit tested before you can wear one for your safety. These are the symptoms of COVID-19. We should all be so familiar with this from our daily screenings. But just to briefly review, this includes fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. These are the potential symptoms of COVID, but they're also the symptoms of a vast array of many, many other things. So when we ask you these questions, we're asking for something that is unusual for you or unusual for the resident. For example, if you normally get headaches, you know what your normal headache feels like. If it's not one of your normal headaches, then we're going to be concerned that you might have COVID and we'll want you to get taken care of right away. Same goes for residents. If you see that they have one of these symptoms and it's outside of their baseline behavior or baseline symptoms, then we're going to want to treat that as potential COVID-19 infection. This one is pretty straightforward. The suspected COVID-19 cases if anybody has symptoms of COVID-19 that we just went over. So if somebody has symptoms and COVID-19 has not yet been ruled out, we suspect that they have COVID-19 and they're going to be placed in isolation. Confirmed COVID is if a positive test has come back and we know for sure that this person has COVID-19. Isolation versus quarantine. These terms tend to get used interchangeably a little bit, but they're actually very different things. Isolation is what we do if somebody has symptoms of COVID-19 and we don't know the results of their test yet, or they have tested positive. Then they will be in isolation for 10 days. Quarantine is what we do if somebody might have been exposed or we know that they have been exposed to somebody who is positive for COVID-19. What do you do if you notice that a resident is having symptoms? Maybe they just came to an activity and they're coughing and sneezing, or they're complaining that they have a sore throat or a headache. Any one of these things can happen. We must take it seriously and place that resident in isolation immediately. Get that cart out, escort them to their rooms, start those isolation procedures right away. Let the med aid know. They'll let the RCC, the nurse, the administrator, everybody know. The med aid's going to put them on alert. They're going to write a progress note, let the doctor know, let the family know, and we're going to get that resident taken care of right away. This is when we start the process of ruling out COVID-19. This doesn't mean that the resident will necessarily stay in isolation for 10 days, but it will help ensure that we're keeping other residents safe, other staff safe. We're keeping that infection as isolated as possible until we can rule out whether they have COVID-19 or not. If a resident comes back from an outing and after screening them, you've noticed that they did actually have a high risk of exposure to COVID-19 during that outing, we must put them in quarantine immediately. We'll start the quarantine procedures, get the cart in front of the room, let everybody know, and we're going to monitor that resident for symptoms for 14 days. This way, if the resident does actually end up becoming symptomatic or showing signs of COVID, we've isolated them during that period and the risk of them having infected anybody else is greatly minimized. This is our policy for managing resident care during isolation. Now remember that isolation is if we suspect that a resident has COVID-19 or we know that the resident has COVID-19. So this is our isolation procedure. We'll want them in a red zone, in a private room, away from other residents. We'll have the signage posted, we'll have dedicated staff. You're going to be wearing your respirators and your gowns when you're taking care of them. We're going to try to keep them in that red zone so that they don't infect anybody else. We're also going to be monitoring all other residents twice daily for any symptoms of COVID if there's a suspected or confirmed case in the building. We want to bundle our tasks when we're taking care of the residents so that we're just in and out of the room as little as possible. If the resident is having really severe symptoms or you notice that they're getting worse and we can't keep them comfortable, then you're going to want to call EMS and send them out to a higher level of care so that we can really make sure that they're taken care of. When you do that, we have to notify EMS that this resident does have COVID-19. That way they can have all of their PPE and their procedures in place for handling somebody who is COVID positive, and they're also going to give the hospital heads up that a COVID-19 positive patient is coming. This is just another way to keep the entire community safe. Quarantine PPE and isolation PPE are only slightly different. We're still going to have the card out front of the room, we're still going to post our signs, and we're still going to follow the local health department's guidance. For quarantine PPE, you will wear a procedure mask, so the masks that we already wear, the face shield that we already wear, and a gown. We're using disposable gowns, we are not reusing them. We'll also be wearing gloves, which we're also used to using because that's what we use whenever we're doing resident care, right? So this is quarantine. Isolation PPE is what you would wear in the red zone. We're still going to place that PPE card out front of the room. We're still going to post signs, follow the health department guidance. But the biggest difference here is that you will be wearing an N95 mask. We'll also have the face shield, gown, and gloves. It is very important to know when you should be putting on your PPE. You should always put on the PPE before entering the resident's room. Whether it's isolation or quarantine, you're not going to go into that room and then decide later that you should put it on. Just have it on before you even enter the room. That's why the isolation card is outside of the room. So if it's isolation, you're going to put on your N95 mask and you're going to put on a gown in addition to your face shield and gloves. If it's a quarantine room, you're already wearing your face shield, you're already wearing your surgical mask, you're going to put on a gown and gloves. Once you've finished providing care for the resident and you're ready to leave the room, that's when you take off your PPE. You're going to dispose of your gown and gloves inside the resident's room in their trash that's right inside their door, and perform hand hygiene and leave the room. And that's it, everybody. We've got this. We just have to continue to be safe and smart and calm You have to continue to stay healthy, but we've got this. So you guys are doing a great job. If you have any questions at all, please let me know. You can post something on Facebook, you can send me a text, shoot me an email. I'm always here for you. Keep up the good work.